Okay, there you go. I had to tell it where to record to. Stupid machine.
Thank you.
Stupid machines. Anyway, we'll start this over again. It is being recorded. Pathophysiology, what does it mean? Basically, it means that you're going to, here's a definition of it. A definition of pathophysiology, the physiology of abnormal states, specifically the function that accompanies a particular syndrome or disease. That's from Merriam-Webster. From the medical dictionary, it's the functional changes associated with or resulting from disease or injury. The specific study of such changes in both senses, also called physiopathology. So there's all kinds of definitions for it. But basically what you're wanting to look at is what's the normal? You know, what is normal for this bodily function? You know, you take like asthma, okay? What's the normal function of the lungs? You know, you got that last quarter. Function of the lungs is to exchange air and breathe in oxygen, get rid of CO2, and keep the body going. So what is the normal for the system that you're looking up? How does the system function? Okay, what are the functioning units of the lungs? Can you tell me? Anybody?
Respiration.
No, functioning unit. That's the alveoli. Those are the functioning unit. That's where the gas exchange takes place. Okay. So how is the disease process interfering with the normal function? With asthma, it is changing the structure of the alveoli and changing the bronchial tubes to where the person can't breathe as well as they usually do. What is it that makes this abnormal for the system? Well, if you can't breathe, you can't do a lot. So there's all that kind of stuff that goes on there. And then what are the causes for the problems with the system or disease? So you're going to look at what are the major causes. Now with asthma, it can be reactive, it could be genetic, it can be all kinds of causes. Are there any organs or systems involved? Well, yeah, organs. When you can't breathe, it affects everything, you know, okay? Maybe your lungs, but it does affect other things that are associated with that. What are the tests that are used to diagnose the disease? There are lab results, there's x-rays, there's CT scans, MRIs, ultrasounds, and on and on and on and on. If there are no appropriate tests, how is it diagnosed? So usually it's by history and physical. It is by symptomology. You know, that's how you're going to diagnose this and that, and going forward from there. Okay. So what are the signs and symptoms? Is there pain? Is there discomfort? Changes in bodily functions, weakness, fever, headaches, you know, what are there? Shortness of breath, you know, say with an MI, you have pain, you have discomfort, you have you're not necessarily a fever, but you break out in sweats. You can have a headache because the medication we give you expands all your blood vessels, not just focused on your heart, but you know, nitroglycerin will give you a headache, a whopping headache. And that's why you have to be careful when you're applying nitro paste to a person's body. You get it on your hands, guess what? You're treating yourself and you're going to get a headache. Okay, so if you get it on your hands, you need to wash it off as soon as possible. Soap and water, just like everything else. Okay, soap and water. What type of medications are used for this disease? Now with asthma, we've got inhalers, we've got corticosteroids, we've got other kinds of treatments that are coming out all the time nowadays. combinations of corticosteroids and bronchodilators and inhalers. Are there different classes of drugs? Yeah, for hypertension, there's ACE inhibitors, there's ARBs, there's beta blockers, there's calcium channel blockers. I mean, so you have all these meds that you're going to be looking for and seeing what is available for this person experiencing this pathophysiology. How do those medications improve the client's condition? Well, with inhalers, it allows them to breathe, okay? With blood pressure medication, it drops their blood pressure so that the blood pressure, which is known as the silent killer, doesn't hurt them, doesn't cause changes in the body that can make those things change, okay? What physical assessments or labs must be evaluated for clients with this condition who are taking these medications? So what are you going to look for? That's what you're going to look at. And you want to make sure that you go over the medications with the client and make sure that they know when to take it and when to stop, when to call the doctor, all those kind of things, okay? So nutrition therapy, is there nutrition therapy that you can give? Now for people with hypertension or an MI, you're gonna teach them about low sodium diet. When I first started, it was 2 grams sodium diet. Now it's even getting more restrictive. 2 grams of sodium is nothing. You go into the grocery store and you can pick up any canned food, any packaged food, and look for the sodium content. And a lot of times per serving, there's at least 1,000 milligrams of sodium in these things. So you have to be careful. And the people that have heart problems or blood pressure problems or things like that, that they need to watch their sodium, you're going to have to make sure that they are able to read and how to read a nutritional label so that they don't get too much sodium in their diet, okay? Surgery, what are some of the surgeries that they can do? For an MI, you can do a PTCA, a pizza. You can do open heart, you can do a cabbage, a CABG. You can do all kinds of things. Alternative treatments, is there acupuncture, massage therapy, chiropractic, stress management? That's a big one that we've come up with, that people need to take a stress management class and learn to manage their stress, because a lot of times stress will lead to an MI. I mean, they haven't quite figured out, well, why does it do that? But it's the release of those catecholamines that stress produces that interferes with the function of blood vessels and everything else in your body, that it can cause problems. Herbal supplements, some doctors poo-poo the herbal supplements, but hey, they work. They do get out there. They do make the difference. But people are going to have to understand what those herbal supplements do. Oh, I heard garlic does well for this and that. Yeah, but it also increases your bleeding time. So if you're on a blood thinner to begin with, and then you are taking garlic supplements, that might not be a good thing, okay? So you have to be careful with that. Oops, back up here, Bill. There we go. What sources can you use? Student planner. No, you guys don't buy a student planner too much here, but your NANDA stems, where do you go? This is a link that will take you to a document that shows you all of the NANDA stems that are out there. Nurse labs, this one here is on the web, and I highly recommend nurselabs.com, because it not only gives you care plans and interventions and reasonings for that, but it also tells you about the disease. Just another source that is a reliable source that you can use. And then there's also nursing diagnosis book. You can look those up and see what you've got there, okay? You also want to look at the concepts that are listed in your syllabi, like safety, assessment, mobility, communications, critical thinking, um, interventions, altered tissue perfusion, altered mental perception, acute pain related to, all those type of things, okay? So this is the template right here that you can download and you want to take and put right up here. The pathophysiology, what are you going to look at? CHF, stroke, whatever, okay? Then you want to define it, definition, and then diagnosis. How is it diagnosed? The causes, the signs and symptoms, the treatments, nursing care, okay?
Bill, I have a quick question.
Yeah.
Are we doing a pathophysiology sheet for each of the types of diseases, or we just pick one from them?
Yeah, you're going to do all of them.
Okay, thank you.
There's like 6 of them. Hey, you guys are getting off easy. When we used to do face-to-face, there were 15 of them that we did. And that we did one a week, one set of them a week. So.
And these are all due Sunday?
No, they're due the 29th by midnight.
Can you adjust that? Because it says they're due the 27th.
Well, if you look at it now, Bryce updated it.
Okay, cool.
Okay.
Thank you.
So these are the ones, the starters, the CHF, COPD, asthma, hypertension, CVA, DVT, peripheral artery disease, and coronary artery disease. And those are the ones that we're going to work on. These are some of the other ones that are there, that if you want to do them, it would be a great thing for you to do, because these are ones that if you build up a pathophysiology list, then you don't have to do it when you're out in clinicals, because you've already got it made. Then you just pull it out of your file and say, okay, here it is. And that one less thing that you have to do when you're in clinicals. Okay.
Where is this PowerPoint?
This PowerPoint is not on the I'm not out there, but I'll put it up there now. Okay, now that we've gone over it. All righty.
Hey, Bill, I just checked that assignment is still say the 27 for the due date.
Yeah, but it's available till the 29th. And I don't mark you guys down for turning these things in late, because I know you've got other things that are important for you to do.
Okay.
It's
But
available.
it's due on the 29th at midnight.
Yeah.
Okay. And you want us to type it up and then
Yes.
turn it in, right? Okay.
Yes, type it up, please, because if you don't have a computer and you're using your phone and you take a picture, don't send me the picture. I can't read it. I mean, I don't know if you guys have seen it, but sometimes when people send us pictures of things, it's like, this big on the computer screen, and you can't enlarge it. I have what is called CS, which is a camera scanner. And you can go out there. There's all kinds of them out there that are free. This one here is free. They ask you, oh, can you contribute? No. Well, that's fine. They still let you use it. And it creates it, turns it into a PDF format. And you can upload it by email or whatever, that way too. And so by creating a PDF, you can upload it to the Canvas shell from your phone, because there is a Canvas for your phone too. It's a phone app that's in Canvas. So any other questions? I'm going to stop sharing my screen here. Although that's a pretty picture. I like that picture. So anybody else have a question?
Yes, there is a list of things that need to be done. The one say kidney, heart failure, stuff like that. So in ATI, and if we did it, how the rubrics is like very long. So I'm confused. I don't know what to do.
So the only ones you have to do are the ones that are in the module, the CHF, COPD, asthma, hypertension, DVT, and PAD. Those are the only ones that are due. So there's
Yeah.
1, 2, 3, 4, 5, 6 of them. And those are the only ones that I'm requiring you to do.
I think
So
she's
for
talking about the
Bellupri-
ATI.
Wait a minute, one at a time. Say again. Lisa?
Oh, I thought she just asked you about ATI, not this assignment, but a different one.
Yeah, I don't know what what are you talking about ATI?
on
The-
on the class 222, it
Right.
has like it has a list of things that need to be done there. It has like heart failure, it has kidney, it has assessment head to toe. So it is done in ATI. So that's what I'm talking about.
Okay, well, those aren't due until July and August. So you don't have to worry about those right now. I mean, if you want to use the system disorder template that is out on ITI, that would be okay, because it basically goes through everything that is there and gives you all kinds of little boxes to fill out. And that way there, it's already there. But that's up to you if you want to use those or not. I'll accept either one. Okay, but the ATI stuff is not due until like July. What did it say here? Let me look back here just a second. First one is July 23rd. So it's not even due for about another month or so, about a month. So that if you want to get ahead of those, I mean, that's great. But those are not part of this portion of the class.
Okay, thank you.
Uh-huh. Anybody else?
Yeah, so
Yeah.
the definition for each, you want us to like write you a paragraph of what it does, or can we like give you a short explanation of what it is?
You can give me a 2 or 3 sentence description.
Okay, so
You don't
let's
have to
say,
go out to the Gray's Anatomy book and give me
right?
the whole definition
I
page.
just, yeah, because that's a lot, like 6 of them, and then we have a test coming up. So I was just wondering, because, okay,
Yeah.
so for CHF, I just say it's the inability of the heart to keep up with the demand on it, which failure of the heart to pump the blood with normal efficiency. Is that be enough, like definition for it? Because I know you say you want the normal structure and function.
Right. So the normal structure of the heart is to pump blood
Mhm.
and deliver oxygen and bring back waste products from the body to be expelled out of the body. And
Okay, so you want me to then say why is not why is the
yeah,
problem?
and what's happened with CHF? Why is it not working right now?
And my definition will be okay for that then, is like when I say.
Pretty much. I'd have to look at it to make sure, but you know,
Okay,
you don't have to give me a whole half page on the definition.
okay. Same with the diagnosis, and you just want like most majority of it, right? But
How is
I
it
list a
diagnosed?
bunch of
How is it treated? You know, is
Okay,
it done? Do they do surgery? Do they do pacemakers? Do they do, you know, whatever?
okay. So I can just list a thing like chest X-ray, ECG, blood test, but don't have to go in of what each one.
You don't have
is,
to go
right?
into great depth. No.
Okay, thank you.
Yeah.
So you're okay with bulletin points?
Yeah. Bulletin points are fine for me.
Perfect, thank you.
Yep.
On the nursing care, are we supposed to do like a NANDA type nursing care?
Yep. The nursing part, I want you to put in like the stem, just the stem of nursing diagnosis. So like for CHF, You know, what would be a nursing diagnosis for that? Poor
I don't
tissue
know, a lot of that
perfusion.
confuses me with the NANDA stuff and doing that paper when I did it with Amanda. I mean, I had to do it like 5 times to get it right. It just didn't make sense to me. So
Yeah,
I just want to make sure I give you what you want because I'm not really understanding how you want me to write. If you want me to write it like patient this, if that, I don't know, at risk
No.
for, how do you want us
No.
to write it?
no. Well, what you need to do is go out to nurseslab.com and type in CHF. And it will give you,
Nurseslab.com.
yeah, and it will give you a list of nursing diagnoses for CHF. And those are what I want.
Nurseslab.com.
Yep.
And that's what you want for the nursing care planned interventions.
Yeah, well, we're not doing care plans. We're just doing the NANDA stems. What are the nursing care plan stems for those things, for that diagnosis?
So like when we say risk for impaired gas exchange,
Yeah,
is that, okay, just list those and,
just that. That's all I want.
oh,
Because
okay.
when we do care plans, that's where you're going to go and expand on those nursing stems.
Okay, so on that website, it have like 18 nursing care plans. So do you want us to list all, like, you know?
No,
I'll just
just
give you a
pick out
brief-
pick out 2 or 3.
Okay, all right, thank you.
Yeah. I'm not wanting a book. Okay.
Okay, because I was like, that's a lot. And I wasn't sure because I already kind of started it, but I was like, I'm not sure if you want me to list all
Yeah.
18 of them.
No, that's fine. Okay.
Bill, I thought with nursing interventions, you mean like things that the nurse has to do in regards to the condition.
But
For example,
that's part of the care plans that you're going to do.
okay,
Okay. Now, Eileen is going to go over those in, let's see, I think that's like in a couple of weeks. She'll do the nursing care plans. Yeah, in 2 weeks, on July 9th, she will do care plans and concept maps. And Eileen will go over that, and that gets more into it. But with pathophysiologies, all I want is the care plan and, you know, the stems for the NANDA stems.
okay, okay, thank you.
Mm-hmm.
And they don't have to start with risk for or in the effective.
It's just copy what's in the nurse's lab, and because it gives you a list of the nursing diagnosis.
Yeah, but some of them say acute pain. Is that will be okay just to say that?
Yeah, if it's acute pain,
Okay.
if that's what they're going to experience, acute
Yeah,
pain.
I just want to clarify because when we write a paper last quarter and the NANDA section, they want us to include like risk for in the fit, you know.
Yeah,
impaired.
that's a
So
totally different assignment.
Okay.
Yeah.
All right, thank you.
Okay, well, I'm gonna go ahead and stop this, and I will post it tonight when I get home. I gotta go get my nose tickled because I'm having surgery on Tuesday. A little minor divot, and so I will not be here on the 29th. I'll be in surgery.
Can you please post that PowerPoint that,
Yes, I will.
yeah, so we can use it as a reference because we got to get started on this stuff as soon as possible.
Yep, I'll post it. Okay. I'll see you guys later.
Thanks,
Bye.
Bill. Good luck.
Good luck on your surgery.
Yeah.
Bye-bye.